exams of national and international exam session. Ophthalmology is an ever-growing dynamic specialty. So the young doctors, after finishing post-graduation, the majority of will be in a dilemma, whether to go for progressive academic sessions or for working. So clearing international and national exams will orient their clinical skills and academic knowledge. Many have a stepwise approach with multiple parts. Clearing initial parts during the residency will help to acquire more systematic knowledge. Here we are going to deal with the more common exams like FAICO, FICO and FRCS. First, I will give you an overview of all these exams. Previously, ophthalmology has been looked up as a subspecialty with limited job opportunities because of number of years for surgical training and costly equipments. The scenario is different in West as it's very good branch they are considered. So after post-graduation, the opportunities is like whether to go for senior residency or work, fellowship or international platform. We also have the national platforms to clear basic exams and FAICO. Here the international exams from 4 colleges, FRCS and FICO and FRC Ophthal. FRCS we are having 4 different colleges. The common is Glasgow and Edinburgh. So first you need to know what's your motive for international exams. You may be interested for additional degree or to increase your post-nominals. Or you are very interested to crack new exams. Or based on job perspectives, maybe your spouse may be there abroad, so you want to settle there, or your family may be there, that may be your interest. Always plan according to your needs and not by looking into your peers. That's your friend is going to clear the exam, but I am going to settle in India only. Then what's the point? So you should always plan according to your need. Have a clear roadmap before starting to write all these exams. When to start the exam? The sooner the better, because you will be fresh from your academics and so it will be easy to clear the exams. The common exam is FICO. It will be basically part 3 and 3 parts are MCQs and we will be dealing detailed by Dr. Miriam. And the FRCS is also 3 parts and the third part is basically clinical exams. So if you clear FRCS and FICO, there are 2 different advantages. If you clear FICO up to part 2, there are many channels are open for different exams. After clearing FICO part 2, can apply for MRCS Edinburgh if the channel is open. That will also open scope for the GMC registration. And also after clearing FICO, even if you didn't appear for FRCS first part and second part, you can appear for FRCS Glasgow part 3 clinicals and OSCE. And also after clearing FICO part 2, you can appear for FICO Advance. After clearing FICO Advance part 3, that is the part 3 FICO, you need to appear only for FRCS Edinburgh part 3. So these are the different channels open after the FICO exams. So ICO exams, international exams, FICO, here it will only give you the post-nominate and also open the channels for other exams. So better job opportunities is a question because you won't get any GMC registration. It will help you to navigate up to FRCS part 2. Cannot practice with FICO at any additional country, expensive. But with FRCS, you can bypass PLAB, GMC registration is possible, can practice at many different countries, better remuneration at the Middle East. So after post-graduation, these are the different channels for you to settle at abroad, or these are the different exams. Even after you clear FRCS, if you want to get GMC registration, there are different other steps also. You need to clear IELTS or OET, apply for GMC license, then so many steps you need to clear. These are different websites for the additional informations. These are the different parts of exams. It's little older, the fees is different. Website links for different exams. So insight into the exam structure is very important. You should plan a study strategy. Better is you develop a communication skill along with your friends. Time management technique is very important for writing the MCQs and also for OSCE and clinicals in FRCS. Help of a mentor will be very good. Strive to be a better clinician. So, most of the time you will be working, and along with the work, you need to manage this studies. Stay positive and work hard. Everything will happen. You can clear the exams very clearly, very fast. Thank you.
Thank you, Dr. Chaitanya. Now I invite Dr. Naveen S., consultant pediatric ophthalmologist and phacosurgeon working in Purple Eye Hospital, Chavara, to present his talk on hassle-free preparation for FICO.
Good morning. I will be talking about FAICO. FAICO stands for Fellow All India Collegium of Ophthalmology. So this collegium has the objective of standardizing ophthalmic education and to with an emphasis on a subspecialty education and to provide curricula for the training and assessment. So as you know, now after fellowship we don't have an exam in our country, so this can be taken as an exit exam after our fellowship. This collegium offers fellowship awards in 10 subspecialties from glaucoma, retina, cornea, comprehensive ophthalmology, refractive surgery, uvea, cataract, pediatric ophthalmology, oculoplasty and neuro-ophthalmology. So who is eligible for FAIC exam? The candidate should be an AIOS member and he should have a basic PG qualification. It can be DO or MD or DNB, and he should have minimum 2 years of experience after completing his post graduation. Along with that, whichever subspecialty we are applying, we need a fellowship in that subspecialty of 1.5 years, or if the person has not done any fellowship, he or she can write the exam if there is 3 years of work experience, practical work experience in that subspecialty. One thing is, as I told, there are 10 subspecialties which we can select, and one person can do maximum 2 specialties and at a time 1 specialty. Examination fees right now it's 10,000 rupees, but we have to take into consideration the travel expenses, and compared to the foreign exams it's less expensive. So the examination process, there are 3 stages. The first stage is a online theory exam, and it's a 2-hour exam with 100 MCQ questions, and the cutoff for passing is 70%, which is flexible according to the difficulty of the exam. And the questions, 50% will be easier, and 25% will have moderate difficulty, and 25% will be hard. So you have to prepare it before writing that theory exam, because 25% will be hard questions, and there are no negative marking. You can attempt 100 questions. So after the first stage, if you are selected, you will get a mail from the AOS, and the center for the second and third stage will be announced. So the second stage is OSCE. Usually 10 stations will be there, and they can ask you, they can show you a clinical image, or can show an instrument, a drug or a device which is particular to that specialty you are applying. So if it's a 10 stations, there will be multiple sub questions for each stations, and the time you are allotted is 5 minutes for each question. The third stage is the Viva OSCE, which happens on the same day as OSCE. And here also you can be asked about a clinical image, a drug or investigation, or an instrument related to the subspecialty, or a surgery video which shows the complications and management, a pathology specimen or microbiology specimen can be asked. So total 20 questions will be there, and there may be 4 examiners. So the pass percentage is 50 percentage. In the second stage, in OSCE and Viva, we will be knowing the center which we are getting, and it's better to know what practice they are doing in that center, and who may be your examiner, because you may they may ask you based on their experience and their studies. So in Viva and OSCE, what they are looking for is, do you have the essential clinical and practical skills to practice that subspecialty. For the online written test, the examination centers are there are 6-7 centers all over India, like Delhi, Bombay, Calcutta. So this happens in IT centers. For the OSCE and Viva, there are different centers for different specialties. Like our Apex institutes will have centers like RP Center, Narayana Netralaya, LV Prasad, Shankara Netralaya. So this is the dates of this year exam. So the application last date was in July, and the online test in November, and the OSCE and Viva is supposed to be in December and January, and by February you will get the results. So how to prepare for FICO exam? First you should go through this revised curriculum for subspecialty programs in ophthalmology, which is available in the AIOS website. So it will give you an idea on what is expected of a fellow. So they have shown like what cognitive skills, what technical or surgical skills are needed for that fellow, and how much is what is the minimum number of procedures you require for that subspecialty. So it's better to go through this curriculum to get an idea on what we can expect as questions. So if you have any doubts regarding how to prepare, there are YouTube videos, like there are 2 videos by TNOA regarding this subject. You can go through that. So regarding the books, you read the book which you read during your post graduation days. Don't read from the first to last chapter. Just go through, just revise that book which you have read during your PG days, and also whichever book you referred for your fellowship training. Another important book which I will recommend is a AIO series, and select the a subspecialty which you are applying, and try to read AIO. You can also get up-to-date information from the journals which have articles on different topics. So first is a MCQ exam. First stage is an MCQ exam. So you need to practice MCQs. There are different ophthalmology MCQ books, like Massachusetts Review Manual, then review questions by Kenneth Chern and Tin Yin Yong. These are essential good books which you can select one and read that book. For the OSCE second Viva and OSCE, there are also different books, like Viva and OSCE exams in ophthalmology, practical guide to Viva and OSCE in ophthalmology. Another important online resource is a One Network. So any AIOS member can access this American Academy of Ophthalmology One Network, and many previous candidates have said like many MCQ questions came from this One Network. And in YouTube we have Eye Focus by AIOS, which has topics regarding our specialty. So one advantage is that most of the topics are dealt by examiners, which you may get in your exams also. So by famous personalities in the subspecialties. So if possible, try to go through this eye focus. So that's about how to prepare, which all things you have to refer. Then there is no point in telling which questions can come, but these are some of the topics which the previous candidates have told. Like in retina, you can expect an embryology or anatomy. Then regarding dyes, you can get a question regarding retinal vein occlusions and studies on retinal vein occlusions, ARN, PORN, then ROP, which can come in retina and also in pediatric subspecialty questions. Then regarding investigation, OCT, angiogram, then lasers, famous studies and clinical trials. Then regarding intravitreal injections, dosage, instruments like vitrectors, bands. Then B scan, they can show you a B scan and ask about melanoma. Then even a pathology specimen, they can show in, they usually show in the laptops what all specimens are. So you may expect electrophysiology questions, ERG. Then in cornea, questions on corneal dystrophies, instruments used for corneal surgeries, then specular microscope diagnostic scans, cornea surgeries and complication. Most of the surgical specialty, you will definitely get a surgery videos and complications, so be prepared for that. Then in uveitis, you will get how to work up a patient. Then main ocular tuberculosis, white dot syndromes is another important topic. Then CMV retinitis, ARN, PORN, masquerades. In glaucoma also, glaucoma workup, then different valves, MIGS, glaucoma studies, and surgical complications and how to manage. In cataract, different types of cataract, congenital, drug induced, ectopia lentis, then pharmacodynamics, special devices, different instruments, biometry, IOL formulas, and different IOLs, toric, multifocal. Then questions can be asked regarding aberrometry, cataract surgery complications, drugs, contact lens. In pediatric, you can expect about congenital cataract, ROP, then basic accommodative esotropia, DRS, IXT, syndromes. You can expect syndromes questions in OSCE and as well as in Viva. Then you will definitely get a nerve palsy. So you will get a 9-gaze picture and will ask us to comment on the picture. So be prepared for that. And in pediatric ophthalmology, refraction is an important topic. You will get a question on retinoscopy. Maybe I got a Jackson cross-cylinder question. Then in orbit, eyelid reconstruction, different implants, instruments. They may have instruments during their Viva on the table, and they may show you some images and comment. Then in refractive surgery, complications of LASIK. So to conclude, we have to keep our basics strong. So how to evaluate a case, then how to manage routine cases in subspecialty. Don't go for the complex cases. You should know how to evaluate routine cases which you see in your subspecialty, and they are looking for looking if we are a safe physician. Like in FRCS, they are looking if we are a safe physician who can identify sight threatening or life threatening condition and manage, and if needed, refer the patient to an expert. Thank you.
Thank you, Naveen. It was a very wonderful talk. Now I call upon Dr. Miriam Joseph. She is a consultant phaco and refractive surgeon at Arya Eye Hospital. She will be talking about FICO preparation.
Good afternoon. So I'll give you a small overview of how to clear FICO. So let's see what's International Council of Ophthalmology in brief. ICO is an organization which has its headquarters in Geneva, Switzerland. The goal of this organization is to standardize the quality of ophthalmic care across the globe. ICO exams are conducted worldwide to help ophthalmologists evaluate their knowledge of basic and clinical sciences. ICO also offers fellowships designed to support young ophthalmologists to improve their clinical skills. They can do this by visiting and observing experts at various top institutions across the globe. So the examination structure, ICO is conducted in parts. There are standard exams and then the final is the advanced 115 exam. So standard exams, there are 3 parts. Part A is visual sciences, part B optics, refraction and instruments, part C is clinical ophthalmology. All these exams are conducted twice a year, usually in March and October. Like Dr. Chaitanya already said, clearing the standard exams, that is part A, B and C, will allow you to bypass the first 2 parts of the FRCS Glasgow examination and directly apply for the clinical FRCS Glasgow exam. So how do you plan the exams? So part A is visual science and part B is optics, refraction and instruments. You have the option of combining these 2. You can do this on the same day as separate exams. So part A, part B, and after that you go for the clinical ophthalmology part C examination. So after you clear the standard exams, you can go to the advanced and after passing the advanced exam, you will get the post-nominal of FICO. You need to give them a proof of passing the local face-to-face ophthalmology examination, that is either DO, MS or DNB exam. And the other one is other pathways to the FRCS Glasgow Part 3 exam. You can straight away go and get the post-nominal. So in a few details about each step. Step A, visual sciences. It is a 120 MCQ questions which you need to complete in 3 hours. It's a single best answer and there is no negative marking. So you can attempt all the questions. The topics covered are anatomy, neuroanatomy, vision, ocular physiology, biochemistry, biology, epidemiology and statistics, pathology and microbiology. So which are the books that you follow? The best are the American Academy of Ophthalmology series, then Basic Sciences in Ophthalmology by John Ferry, Basic Sciences in Practice by Forrester, Anatomy and Physiology of Eye by Dr. A.K. Kurana. Step B covers optics, refraction and instruments. This exam has 60 MCQs which you need to complete in 90 minutes. This is also single best answer, no negative marking. And the books that you need to follow is Clinical Optics by Elkington, which in my experience I felt it was the best one. Theory and Practice of Optics and Refraction by Dr. A.K. Khurana, Duke Elder's Practice of Refraction, and you can practice MCQs with Chua Optics MCQs which you can get online. Like I already said, combine A and B, that is visual sciences and optics and refraction. You can save time. You can do it as on the same day as separate exams. And the best time to take part A and B is during your second year of residency, because you will get an idea of what ophthalmology is in the first year and you will start reading on the basics which you can give the exam. And step C is clinical ophthalmology. This has 200 MCQs in 4 hours. Here also single best answer, no negative marking. All the clinical part of ophthalmology, that is general medicine related to ophthalmology, community and public health, ophthalmic pathology, tumors, neuroophthalmology, pediatrics, oculoplasty, cornea, lens, retina, uveitis, everything is covered in this. This can be given only after clearing steps A and B. And best time to give the exam is immediately following residency, because in residency you would have read up on all these things and you'll be fresh. Your theory will be fresh. And the books that you follow, you can follow any standard ophthalmology textbook. Kansky is one of the best books for that. Then AAO series. And for MCQs, you can follow Massachusetts Eye and Ear Infirmary Review Manual of Ophthalmology, Review Questions in Ophthalmology by Kenneth Chern, and ProVision 5 series. Now coming to the advanced 115 exam, it can be given only after clearing steps A, B and C. There are 10 extended matching questions and 75 MCQs, and the duration is 3 hours. It mainly tests clinical acumen, application of knowledge, common sense and decision making. And you will have to prepare all the subjects covered in all the previous steps of the exam. Now, a few pearls I would like to share is that it is not mandatory that you read all the books that I've mentioned. It is important to read, understand, and apply the basic textbooks, and you need to have a good base. Application of subject is more important than mugging MCQs. These exams, the questions are like you need to really read each option, because there will be one catch in each sentence, and that will be the point which will exclude that as the answer. So there will be, I mean, like when you read the question, you'll be like, okay, this could be the answer, the next one could be the answer. So you have to read it carefully with common sense. That's the one I want to emphasize. You need to have common sense and apply the basic knowledge that you have. Now, a few words about ICO subspecialty exams. This is offered to ophthalmologists who have completed a minimum of 1 year of training in their chosen specialty. The exams are conducted in almost all the specialties like cornea, glaucoma, retina, oculoplasty, neurophthal, pediatrics, and uveitis. So, why should I prepare? The standard of education, patient care and training is variable across the globe and across India also. Various institutes you'll get good training, but there are certain institutes where doing a residency is merely a formality to get MDMS postnominals. So such residents can brush up on their theory and practical by learning for FICO in a systematic manner. So this I've already mentioned just to highlight the best time to apply for ICO. Step A and B during the first year of residency if you're doing DO, or second year of residency if you're doing MS or DNB. For step C, it is better to plan immediately after completing your residency. An advanced exam can be given immediately or within a year of completing residency. Now the fee structure. Step A, this is an approximate. You'll get a better idea after you apply, because each year the amount goes up. Step A is around 460 Swiss francs, which comes to around 44,000 rupees. Step A and B combined, it is 610, which comes to 58,000 rupees. And step C and advanced is 760 Swiss francs, which comes to around 73,000. So how do you apply? Application for the exam can be submitted online via the ICO exam registration site. First, you need to create an account and register yourself, and the application process is pretty straightforward and simple. And exam fee can be paid online via wire transfer. This Dr. Chaitanya has already highlighted. Just a few pros. It's an internationally recognized postnominal, that is FICO, and there is exemption from step 1, 2A and 2B of FRCS Glasgow. And you can get an opportunity to pursue short-term and long-term sponsored fellowships. You'll get an amount to go abroad and observe. This is just an observership. And exposure to different working styles, reading and revising the subjects in systematic way. There are certain people who have the joy of giving exams, they can go for it. Then there are better future opportunities. You can add a postnominal to your CV. Cons, which I would like to highlight, is the financial impact, because this exam, usually you give in the initial period of your residency or the initial when you're setting up your practice. So financial impact is there. And another thing is that FIC is not a licensing exam. You don't it doesn't allow you to work in foreign countries like UK, Australia or UAE. And then also there is lack of exclusivity, because a lot of people are writing FICO nowadays. So it's just an addition to your CV. That's all. Thank you.
Thank you, Miriam, for the wonderful talk. Now I will be dealing with FRCS Part 1 and Part 2. FRCS is a very prestigious exam and it will help to improve our career opportunities and international mobility. Along with that, it will help our clinical skills to improve and improve patients' care. Also, along with our ability to go for the research. As already discussed, there are 3 parts for the FRCS Glasgow. Basically, we are going to discuss here the FRCS Glasgow. And 2 parts are basically MCQ exams and the part 3 is OSCE and clinicals. Coming to the eligibility, for the part 1 you need MBBS pass with 1 year internship. So you can even appear for FRCS part 1 after just getting into the ophthalmology first year or even by second year. Because for part 2 FRCS you need either the pass of FRCS part 1 or ICO part 1, and also you need 4.5 years of experience after internship. So even if you clear the exam by second year of your post graduation is also okay. And for the part 3 you need to clear FRCS part 2 or either equivalent parts like ICO. Part 1 FRCS is basically MCQ exams. Here the topics will be from basic science and optics and refraction. 160 MCQ questions will be there. 2 hours is the exam duration and the exam will be held twice a year by online. These are the books basically for reading for the FRCS part 1, and as already Dr. Naveen and Dr. Miriam already very detailed, they have mentioned all the books that are also very useful for the FRCS part 1. Just to compare between ICO part 1 and FRCS part 1 MCQ, both MCQ questions, but the format is also almost same. Single best answer, the options will be 4 for the ICO and 5 for the FRCS, and the duration optics and refraction plus basic science will be 4.5 hours for ICO and 2 hours for the FRCS. So when comparing the number of choice and the time duration, little we will fall towards the ICO side. Fees and difficulty almost same. Coming to the part 2 FRCS MCQ, here you need to cover all the clinical subspecialties of ophthalmology. Along with the medicine and neurology questions will also be there in the part 2 FRCS. That's also an online exam, twice a year, 180 MCQ questions, 2.5 hours duration. Just to compare between ICO and FRCS, here also FRCS the number of options will be 5 and for ICO it will be 4. And the time duration is also 4 hours for ICO and 2.5 hours for FRCS. Fee structure is almost same. Just to see, this is a question from ICO. Which of the following tumors is least likely to cause cellular infiltration of the vitreous? And the option is 4. You need to choose one answer from the 4 choices. When coming to the FRCS question, here in a patient with type 2 diabetes mellitus, diabetes macular edema has been observed. What is a major risk factor? So you need to choose the answer from 5 options. That is the trick between these 2 exams. So many resources are available online. So IQ is a part 1 ophthalmic science. It's available software, either premium and basic free is there for MCQ questions. Dual revision questions are also available. For part 2 clinical ophthalmology also IQ questions are there, premium and free. CHUA website is very useful for the MCQ as well as for the clinical OSCE questions. You will get past candidate experience also from the CHUA website. So many books were there. Kansky is one of the best option along with American Academy of Ophthalmology. And for ICO and FRCS, provision questions is also there, MCQ questions. As Dr. Miriam said, don't mug up the MCQs. Be thorough with your clinical knowledge and use your common sense during the exam, because to get the answer, most of the time all the answers will look like very similar. You just need to catch what is the correct answer. So just few tips to clear the exam. You need to prepare. Adequate preparation is there needed. Adequate preparation as by the knowledge, and also you need to prepare very thoroughly for the knowledge wise, and also for the exam date, exam place where you are going, and the previous candidate experience also. How to act on the day of exams? Be over prepared. That's the best answer. Part 1 and part 2 is online. Get on the server early. Ensure proper internet connections. For the part 3, plan your route beforehand and get there early. For part 1 and part 2, there are 2 exams per year. And for part 3, they will open up in a specific date. You need to apply in that specific date. And if you refresh 2 or 3 years time, you will be knowing which places will be getting open. If you are for abroad exams like others foreign centers, you need to apply for the visa, and booking hotels will be also you need to plan ahead. Wearing appropriate outfits, that's also very needed. Answer all questions for MCQ because there is no negative answer. Return to the questions you don't know, the difficult questions later. Manage your time for both the MCQs and for the clinicals is a very must. Read the questions carefully. Keep calm and collected. You can clear the exams very easily. Thank you.
Thank you, Dr. Chaitanya. Now I invite Dr. Anne Teresa Anthony for her talk on FRCS Part 3. She's a consultant for phacosurgeon working in Amita Eye Clinic, Tiruvalla.
FRCS Glasgow. It's an easy exam to pass if you are prepared well enough. Unfortunately, equally easy exam to fail also. So, with a structured approach and the right mindset, you can easily tackle it. So, over the next few minutes, I'll outline about the study materials, study strategies, and insights into the exam structure that will definitely help you to streamline your preparation and succeed in this milestone. So let's see what are the routes to FRCS Glasgow. You can either go through the FRCS route, that is by clearing part 1 and 2 of FRCS, or if you clear till FICO, or if you clear till FICO clinicals, you can directly go to FRCS part 3. The exam is usually conducted 3 times a year in India, and in February it is conducted in Bangalore, and in September it is conducted in New Delhi, and in November it is conducted in Mumbai. The main stress factor for this exam is the fee structure. The recent fees was about 1,725 pounds, that is about 1,84,000 Indian rupees. So it's always better to give the exam as early as possible, because every year they are making a 10% increase in the exam fees. So how to apply for part 3? Keep checking the website for the date announcement. Visit the Royal College website, navigate to part 3 section, and register your interest for exam once the center is opened. Then you need to, once you get the seat confirmation, you have to upload the attested documents of your FRCS Part 2 pass certificates, internship completion certificate, and the certificates showing the 60 months of clinical experience. And once you upload the documents, they will send you the link to pay the fee to your login ID. So part 3 basically consists of 2 days of face-to-face examination. First day consisting of structured oral examination, and that is a viva, and the second day is the clinical examination. So, understanding the basis of evaluation is very important before preparation. So, accomplishment of FRCS indicates that a candidate has a sound knowledge in ophthalmology and is experienced and competent at applying that knowledge to the patient suffering from common ophthalmic condition. So, what they are actually assessing is whether this doctor is safe enough to practice in UK with the skills of a general ophthalmologist. So, advantages, it has been already highlighted by Dr. Chaitanya. The main advantage is you are eligible for direct GMC registration at UK without qualifying the PLAB exam. Obviously, it gives you recognition among your patients, among your colleagues. That's the reason why I'm standing here and presenting. And when you apply for when you go for a job interview, it gives you more weightage, and it gives you good pay scale, especially in Middle East. The disadvantage is it is not intended to validate subspecialist expertise. The most commonly asked question: when to start preparing? The earlier you start, it reduces the exam stress. So there is no right time. Start now. So now let's go into the study materials required. Kensky latest edition is the base book for preparation. It's like your Bible. Read every page, every line, and every word. Be familiar with the pictures because you can get similar pictures from Kensky in your Viva day. And don't neglect the small chapters like conjunctiva, sclera, dry eye, tumors, because a lot of questions are going to come from these areas. And if you go through your Kensky well, it's very difficult to fail in this exam. Studying previous experience is mandatory. You can download this from Professor Muthuswamy Telegram group. Go through at least last 5 years of past candidate experience. The same scenarios may get repeated. Even though Kensky is the base book, reading Kensky is not only enough. Practical Guide to Vivanovsky by Wong is a wonderful book. I'll say it's a must-read book because it has helped me a lot during the preparation. And almost all the important clinical scenarios that will be asked during the Viva is given in this book. The format that you need to follow while answering, you can get from this book. FRCS Cakewalk is a mandatory book during preparation. The structured way of clinical examination techniques are given in the initial chapters of this book. Oxford Handbook of Ophthalmology is very useful during revision. This book actually, we can say it's a mini Kensky. All the points, especially the treatment part, guidelines, everything is covered in a nutshell. And joining Professor Muthuswamy Telegram group will definitely help you during the preparation time. You can join this group by dropping a mail to Professor Muthuswamy requesting him to add you to the group. Actually, these Telegram group, they have mock exams and there are very dedicated volunteers who will guide you in the preparation, and it is completely free of cost. So participate in the mock exam, present topics, have the courage to make mistake and get them rectified before the exam. Vivanovsky by Timothy is a very vast book. This book covers almost all the scenarios, and the treatment part is given according to the UK NICE guidelines. At least the answers of certain scenarios which is not given in the other book, you can get this from this. You can get it from this book. And the ability of the candidate to manage the common emergencies is analyzed in this exam. Focus on emergency medicine on the last month of preparation because as ophthalmologists, we are not dealing with it on a daily basis. And try to get help from a person who is trained in emergency medicine so that he can help you in answering in that ABCD approach. And these are the must-know topics that you should go through. Practice the clinical examination technique daily in your clinics. These are the must-know examination techniques. You will be asked to demonstrate all these examination techniques and you will be judged based on that. You can watch the videos of clinical examination from the Chuba MRCS website. It's very helpful. There are good reference videos of pupil ocular motility examination, third nerve, sixth nerve examination available in this website. Online courses like I courses is also good for reference video, but the disadvantage is you have to pay a significant amount of money to subscribe it. Next, we'll move on to the study strategy. When you are aspiring for something great, have proper plan and work on it step by step. 6 months of targeted preparation is needed. Start with your Kensky and with the previous candidate experience. Be thorough with Kensky 2 to 3 times in this 4 months of time period. Meanwhile, you can practice the clinical scenario with the mock exam. By the time most of you write FRCS Part 3, you will be working as a consultant in some subspecialty. So, in order to brush up the other areas, you need to start seeing the general OPD cases. And try to get a study partner, because encouragement from the study partner can keep you motivated in the track. And keep the final week for quick revision. Avoid learning any new material during the last week. The most challenging part, how to balance study, work, life. The chances are high that you will be very busy with your work, so always set boundary. Clearly define when you will work, when you will focus on studies, when you will focus on family. So avoid overcommitting to extra work during the last month of preparation. Plan smart, not hard. Use the clinical practice as the learning tool. Practice, practice, practice. This is the key for success, because you will be having a lot of knowledge about the subject, but how to comprehend these things and answer in a nutshell, you need lot of practice. Review the cases that you see in OPD and discuss with your colleagues. Improve your communication skills and learn to answer quickly and clearly. Next, we'll move on to the exam structure. First day is the orals, there is a Viva day. Your slot will be informed to you prior via the email. So, in the Viva day, you have to go to 3 tables. So, each table consisting of 20 minutes. It's like a rapid fire sort of examination. There will be 2 examiners at each station, and one examiner will be asking you question, and the second one will be assessing you and putting marks. And in the neurology and neurophthal and medicine station, one examiner will be a physician. Give more weightage to the neurophthal station because this is the station where most of the candidates fail. And everything is covered here. Unlike in Indian exam, we have the luxury of leaving neuro-ophthalmology, but here you have to pass all the station. And there will be image-based question and printed clinical scenarios. Examiners will be looking at certain keywords. Unless they get that keywords, they won't proceed. And in the Viva, what you need to remember is describe the findings systematically and always try to give maximum differential diagnosis and always say the common differential diagnosis first. And you will get an off day between the Viva and clinicals. So practice with your study partners in a common destination. I had the opportunity to practice with my study partners, and we literally did not leave even a single probable case. So actually the clinical day was really a walkthrough for us. The clinical examination day, you will get the real patients. You have to go to 4 stations. So 12 minutes at each station, and there will be 2 examiners. You will get a minimum of 2 and maximum of 4 patients. The more patients you see, the better. This is an example of a sample case. This is a sample case of posterior segment. Here you will be given, the examiner will ask you to examine the patient with 90D or indirect, and you have to say the positive finding first and then arrive at the diagnosis. Then you will be asked questions like what else will you ask in history to know whether you are aware about the associated syndromes of RP. Then they will ask you about the management and genetic counseling. This is how the exam goes. And for the clinical examination, the key factors for success are time, speed, and presence of mind. Speed is required to see more number of patients. The more number of patients you see, the more is the chance to pass. And presence of mind is very crucial for your success, because if you have done bad in certain station, forget about it and concentrate in the next one. So the reasons for failure are missing an important clinical sign, not knowing at least a differential diagnosis, and doing a fatal mistake. So exam is actually a mind game. Knowledge and experience is with everyone, but who manages his anxiety in that moment comes out as winner. A confident and the calm mind is the one who wins the battle against the anxiety. So have a proper study plan, practice regularly, be thorough with your Kensky, and stress management is very important during the exam. So if you have any queries regarding the preparation, you can mail me. Thank you.
Thank you, Dr. Ann, for the wonderful presentation. Now the discussion is open. If any queries, can please ask. There is no such validity problem. The attempt is 6 times. If you fail for one exam, one part, you can appear 6 times. Validity is not a problem. But sometimes they may change the model of exam. Till 2021, Part 2 exam was of 2 parts, Part 2A and Part 2B. Part 2A was an MCQ exam. If you coming through FRCS route, FRCS Part 1 you have cleared. So for appearing to FRCS Part 2, you need to clear FRCS Part 2A and Part 2B. Part 2A was MCQ and Part 2B was for written theory question. Now from 2021, they changed that model. Now Part 1 is MCQ, Part 2 is also only MCQ question. No theory based question is there. So that type of changes can happen during these years. Not only for the number of attempts they are keeping this limit. And the clinical exams will help you to see the patient systematically at the OPD also. If you practice for this FRCS exam, you know how to see a patient systematically. Usually we will all examine the patient in a we will examine all points, but sometimes we may not be very systematic. We may miss some point. But if you practice for this FRCS, the systematic examination will be learned, and that will be very helpful for your OPD management also. You won't miss any points. Thank you. Thank you all for attending our IC. Thank you all.